Hello everybody. Today we're going to study about the hip bone. So hip bone is an innominate bone. Innominate means that it does not have a specific name. It is just named according to the region it is lying in. So it is lying in the pelvis. Talking about the parts of the bone, it has an upper part that is known as ilium. Inferiorly, it has two parts. One is the pubis, this one, and the other one is ischium. Talking about the parts of the bone first, let's talk about the ilium first. So ilium has three borders, three surfaces, and two ends. Talking about the ends first, it has an upper end. You can see this is also known as iliac crest. So this iliac crest is convex upwards. Like if we see the bone in this view, so in the front it is concave inwards and behind it is concave backwards. So the iliac crest, it ends in two spines. This spine, this is known as anterior superior iliac spine, and the other one is posterior superior iliac spine. The other end, that is the lower end of the ilium, it merges at the acetabulum along with pubis and the ischium. Talking about the borders of the ilium, it has three borders. So this is the anterior border. Anterior border, it begins from the anterior superior iliac spine, presents a shallow notch, passes through anterior inferior iliac spine and goes a little beyond that, above the acetabulum. Talking about the posterior border, it begins from the posterior superior iliac spine and passes along with the posterior inferior iliac spine and then passes up to the middle of the greater sciatic notch. Talking about the third border, that is this border. So this border is the medial border of the ilium. This border separates two surfaces of the ilium. So this surface is the iliac fossa and this surface is the sacropelvic surface. So in between these two surfaces is the medial border, which begins from the iliac crest and passes till the iliopubic eminence. Yes, this point you see here, this is the junction of ilium bone and the pubis bone, and it presents an eminence here that is known as iliopubic eminence. Now talking about the surfaces of the ilium. So it has three surfaces. This surface is the iliac fossa. This rough surface is the sacropelvic surface, and behind we have the gluteal surface. So iliac fossa is a shallow depression on the inner side of the hip bone. Sacropelvic surface is an uneven surface. It presents three parts. So this ear-like part you see here, this is the auricular surface. So this part is articular, as it articulates with the sacrum bone to form sacroiliac joint, which is a plain synovial joint. This part here, this is the iliac tuberosity, and this part is the pelvic part. Talking about the gluteal surface, so gluteal surface presents three gluteal lines, out of which the posterior gluteal line, it is the shortest line. So it begins 5 cm behind the posterior superior iliac spine, goes downwards and ends at the upper part of the greater sciatic notch. Talking about the anterior gluteal line, it begins from 4 to 5 cm behind the anterior superior iliac spine, goes downwards and ends at the middle of the greater sciatic notch. Talking about the inferior gluteal line, it is the most ill-defined line and it begins from the anterior inferior iliac spine, goes and ends at the apex of the greater sciatic notch. So these three lines divide the gluteal surface into four areas from where the gluteal muscles, they origin. Talking about the pubis bone, so pubis bone has one body and two rami. This is the superior ramus of the pubis and this is the inferior ramus of the pubis. Talking about the body again, the body has three surfaces. This one is the symphysial surface of the pubis, also known as the medial surface. It is known as symphysial surface because it articulates with the pubis of the opposite side of the hip bone to form symphysial joint, pubic symphysis, which is a secondary cartilaginous joint. Second surface is this surface, that is the smooth surface. It is known as pelvic surface. This surface is the ventral surface of the body of the pubis. Talking about the borders now, it has only one border, this upper border, and it is also known as pubic crest. This pubic crest ends in a tubercle, and this tubercle is known as pubic tubercle. This one. Talking about the ramus of the pubis, so this one is the superior ramus. It has 3 surfaces and 3 borders. Talking about the borders, so this here, this sharp border, this is known as superior border, or it is also known as pectinate line. Below it is again a border, that is the inferior border. So this inferior border is forming the anterior margin of the obturator foramen. Anteriorly we have one more border, that is known as anterior border, or we call it obturator crest. Now talking about the surfaces of this ramus, between the superior and anterior border we have a triangular surface. The surface is known as pectineal surface. Between the superior and inferior borders we have the pelvic surface, and between the obturator crest and the inferior border we have the obturator surface, or we can also call it ventral surface. Talking about the inferior ramus, so inferior ramus has 2 surfaces, 2 borders. Inferior ramus also unites with the ramus of the ischium bone to form conjoint ischiopubic rami. So it has 2 surfaces, 2 borders. This one is the upper border, this one is the lower border. 2 surfaces, this one is the inner surface and we have the outer surface. Inner surface presents 2 ridges which divides it into 3 areas, upper, middle and lower areas. So this was about the pubis bone. Talking about the third part, that is the ischium part. So ischium has 1 body, 1 ramus, 1 ischial spine. This is the body of the ischium. This is the ramus of the ischium, already studied. This one is the spine of the ischium. So body also presents a tuberosity, that is known as ischial tuberosity. Talking about the body now, body has 3 borders, 3 surfaces. 3 borders are such that it has 1 anterior border which is forming the posterior margin of the obturator foramen. Remember, the inferior border of the superior ramus of the pubis was forming the anterior margin, and the anterior border of the ischium is forming the posterior margin of the obturator foramen. It has 1 posterior border and 1 lateral border. In between the posterior and the lateral border, the body of the ischium presents the ischial tuberosity, also the dorsal surface of the ischium. In between the anterior and the posterior border, the ischium presents the pelvic surface, and in between the lateral and the anterior border, it presents the femoral surface. So this surface is the femoral surface of the ischium. So this here is the ischial spine. Above the ischial spine, it presents a notch, that is the greater sciatic notch. Below the ischial spine, it has a lesser sciatic notch. So this was all about the hip bone. Let's talk about some important sex differences in the hip bone. So iliac crest, this you see, it is more marked in males. This iliac fossa, it is shallower in males and it is deeper in females. Ischial spine, it is inverted in males, everted in females. This ramus, that is the conjoint ischiopubic rami, this is everted in males and inverted in females. Talking about the, so you see this, I'll just keep a pen here. So you see this, that over the medial border I have kept a pen. So this pen, this is an imaginary line passing from the medial border till the iliopubic eminence in such a way that it passes through the iliac crest. So this imaginary line, it is divided into 2 halves. So this half is the sacral part and this half is the pelvic part. In females, pelvic part is longer than the sacral part, and in males, sacral part is longer than the pelvic part. So this is the most important sex difference, and this imaginary line, this is known as chilotic line. Talking about the acetabulum, so all the 3 bones, they unite at the back and form the acetabulum. So acetabulum is deeper and larger in males, whereas it is smaller in females. So these are the few important sex differences in the hip bone. The anatomical position of this bone. So it has 3 points. First is the anterior superior iliac spine and the pubic tubercle. They have to be in the same coronal plane. Second point is that this surface that we have studied, this is the symphysial surface of the pubis bone. So this surface should be in a median plane. It should be straight. Third point is this pelvic surface of the body of the pubis, it is directed backwards and upwards. So if these 3 points you match, you can hold the hip bone in the anatomical position. Talking about the side determination of the hip bone. So ilium, it forms the upper part, which is the fan shaped part. Antero-inferiorly we have pubis bone, and posterior-inferiorly we have the ischium bone, and the acetabulum, it is directed laterally. So this hip bone in my hand, it is of the left side. That's all. Thank you.